Dr. Debra Furr-Holden is our newest Charles Stewart Mott Endowed Professor of Public Health at Michigan State University's College of Human Medicine. She earned her Bachelor of Arts degree in Natural Science and Public Health and a doctorate in epidemiology at Johns Hopkins University. Dr. Furr-Holden is an epidemiologist and classically trained public health professional with expertise in drug and alcohol dependence epidemiology, psychiatric epidemiology, and prevention science. Her research focuses on policy interventions and environmental approaches to violence, alcohol and tobacco, and other drug prevention. She has worked with local and national policymakers to improve data-driven decision-making across a broad range of behavioral health topics to include health in all policies. She is a former Flint resident and attendee of Flint Northern High School and Flint Central High School. Dr. Furr-Holden has a commitment to Flint that stems from her formative years. Her Flint-based work focuses on structural interventions to address behavioral health inequalities and promote policy interventions to improve public health for Flint residents. Please welcome Debra Furr-Holden.
It's still morning, so good morning. I'm actually going to start a timer because when you have the dubious distinction of going last, you butt up on the food. So I'm not going to go over 10 minutes, but I want to start off. I know we've already done acknowledgements, but I want to say thank you to the Mott Foundation. From my history in Flint, the Mott Foundation has always had a very large presence. And I will say I am deeply moved that you see the connection between public health and human capital and made this investment. So thank you for that. I also want to acknowledge that I have many people from my peer group, my family. I got into public health in large part because I see it play out. Dr. Neighbors talks about disparities. I was sharing with a colleague earlier, my father died at 37. My mother died at 56. I'm 41. I have no living parents or grandparents. When you are an African American, what disparities look like on the ground floor, this is not an uncommon tale. So to that end, my two aunts, my mom's sisters, have come here. And if you had ever told me they would come back to Flint after their sister passed, I would have never believed it. So I want to just say thank you to my aunt, Phyllis Billings Griffith, and my aunt Victoria Billings for coming. I have a few other acknowledgments, but I'm going to integrate them into my words because I did get trained by Dr. Neighbors. It all is important, but we want to eat after this. Okay, great. So I started off my early career actually as a biomedical engineering major at Johns Hopkins. And my uncle Raymond, was both a substance user and a diabetic. And you know, that's a very dangerous combination as far as health and vitality. And my Uncle Raymond had what I can only describe as the most dishonorable human prosthetic I'd ever seen. It was literally like a pirate's leg. And so I thought people should be able to maintain their dignity in the whole process of their life and in the process of restoring their health. So I started off a biomedical engineering major because I wanted to make movable, lifelike prosthetic limbs for people who had lost their limbs, whether it be to tragedy or disaster or diabetes or substance use. That didn't work out. I didn't like my peers, right? I spent most of my time as an early biomedical engineering major in a laboratory with people who I could not imagine spending 80 hours a week with them, crammed up in a very small space. So I started looking for another major that allowed me, I know it's really bad, I'm sorry for all the engineers if that's offensive to you, but it is a really unique group of people. They do great, important work. I just couldn't work with them 80 hours a week. So I looked for a field that would allow me to fulfill my big goal that people be able to maintain their dignity in their life and in their health. And I found public health. And since I was pre-med, natural sciences, public health, it allowed every course I had taken up to that point to also fulfill my major. So that's how it happened. At the end of my sophomore year, fell into public health out of biomedical engineering. And I thought, well, since I don't know anything about the field of public health, I better learn a few things. And I had to work, so I went and I found a job at the Hopkins School of Public Health with someone who would turn out to be a lifelong mentor. He told me, anybody who's doing anything worth doing has a mentor, and that's Jim Anthony, who is a big part. Please give him just a little hand. And in our field, the joke is, if Jim was a virus, the whole field of epidemiology would be sick, because he has touched everyone. Specifically in the world of behavioral health epidemiology, there is not one person that I don't know that Jim has not had some interaction with them, and for many of us had a profound hand in our training and development. So I sort of stumbled into public health, and Jim as a mentor and an advisor is really great because, you know, I've always been the person who wanted to sort of do it my way, blaze the trails. And I came out guns a-blazing. You know, the second I started learning statistics, I became like a statistical critic. I started critiquing everybody's work. And he said, Deb, you got to do something. Before you can go out and change the game, you first have to learn the classics, right? So let's get an ounce of humility here. Let's really get some footing in public health. Let's make sure you know what you're talking about before you start spouting off at the mouth in front of, you know, some of the world's most renowned researchers, because he'd take me to these big conferences. And, you know, I'd be there, Ron Kessler, some of you folks from University of Michigan, some of these other folks would present, and I would say, well, this doesn't make good sense because you should have did it that way. And I'm challenging somebody who's 40 years in the field. And so I really took hold to understanding the classics of public health, and then I found my niche. And most of my work is really built on the classics, the very fundamentals of public health, rooted in epidemiology and biostatistics. But those are really tools to understand health. So I started to kind of shift gears and really look at, from a sort of big social determinants of health perspective, you know, if we have great interventions and great programs for people, but we send them back to communities that aren't supportive of that health, have we really made a difference? You know, my mom was also a diabetic. She participated in a program, in a nutrition education program. And the nutritionist gave her all of this great insight on how to prepare a diabetic meal. And when I went to her house, I was really sad, because she showed me this diabetic meal that she had prepared. And I said, Mom, can you explain to me how what you have is a function of what the nutritionist told you? And she said, well, she told me not to fry anything. So I broiled my steak. But she had put a big blob of butter on top of it. Not realizing if you were going to put that big blob of butter on it, you could have just fried it on top. It was the same difference, right? She told me that I should have green leafy vegetables. So she had this pot of broccoli, but my mom used to she called it broccoli mash. She would boil the broccoli until all of the nutrients were in the water, which stayed in the pan. And then there'd be this broccoli mash that would go on the plate. And I started to think about what the community that we lived in was like, what kind of food options were available at our local market, which was sort of a mid-level market. I started to think about the gap in between. My mom was a very smart lady, but the woman who was speaking to her wasn't speaking to her, a very smart lady, in terms that made sense that she could actually translate into her actual health behaviors. So I got really interested in how do we create both the healthy context and environments where all of the very important work that's being done in hospitals, where all of the very important work that's being done in engineering labs, where all of the very important work that's being done at the bench actually means something for people on the ground floor. And that's when I became somebody who fundamentally started to work on health, and particularly health in all policies. So with that said, I come to Flint. I don't even want to come to Flint. I lived here as a teenager. I wanted to visit Flint until my mom died. Then I almost never wanted to come back here. And so I came because a good friend and colleague and advisor, good old Uncle Jim, said, you should hear them out. And then Jeff Dwyer, who should be a salesman. I mean, I am not even kidding you. He's working for MSU Extension now. It is I am so happy for the state that where is Jeff? I am just so happy for the state that you will have a much bigger presence. I'm sad for us, but I'm happy for the state that you'll be doing what you do. I think you are masterful at creating relationships with people and really enrolling people in what's possible. So I came here, 5% chance I would actually come to Flint. After the first meeting, it was a 15% chance. And then on my third visit, I got to meet with the big, broad group of community folks. I went from 5 to about 15, 30% in that in that second visit. And Dr. Bailey was one of the folks that were there, and Dr. Key was there. And then they brought in the big gun for my final visit. And I got to sit with Ms. Deloney for what was supposed to be a half hour. And it turned into about a 2.5-hour meeting where we created a scaffolding for a proposal that I would submit in partnership with Jennifer Johnson, who should have saint status, by the way. Jennifer Johnson is the first one. She was the boldest one of us all who took the plunge to come to Flint and then personally work with each one of us as we made the decision for coming. For that, I am just eternally grateful for you. At the end of that meeting, I got something about Flint that I didn't have before. I thought Flint needed me. And what I walked away realizing was that I also needed Flint. I really wanted to be in a place where people were really up for the hard work, getting our hands dirty, getting in on the ground floor, not to do something that would be progressive. I didn't want progress. Flint doesn't need progress. And I love the way Woody couched it. You know, when you sort of look at your career, you think, oh, I've moved the needle on a few things. But really what you want to do is you want to change the whole game. So we created in that meeting the Flint Center for Health Equity Solutions, because we're not trying to make progress. We're trying to make real solutions to real challenges that are impacting people's day-to-day lives. So I got in that meeting. Flint didn't just need me, but I needed Flint. I've probably gone very close to my 10 minutes. Let's see where I am on my thing. And if I am, I'm going to end there. 10 minutes and 4 seconds. So I'm going to go 20 seconds over. And I want to say that I've been completely humbled in the process. I think this community participatory process is absolutely the way that it has to go. And I'm truly honored that I've been included in that process. And I'm really grateful. I'm grateful to you, the community people. I'm grateful to you, the Mott Foundation, to the MSU leadership. I'm really grateful that you picked me. And more than anything, I give you my word that we're going to deliver on everything that we've promised. Everything that you've invested in, you're going to get the return on that investment multitudes over. And we're not going to do it to you. We're not going to do it around you. We all move to this community. We all live in the city of Flint. I have the same questions about my water that you have about yours. We are a part of this community, and we will work with you to collectively make Flint the great city that it is. Thank you. And I'm wearing mine to work too. I'm wearing it to the airport.